Great. Thank you, Catherine. Welcome, everyone. Good afternoon to those of you who are not from the West Coast, and good morning, I guess, to those of you who are. This is the next in our series of webinars. We do these approximately quarterly throughout the year, and it really originates from the CRD Evaluation Working Group. And we'll be talking today about collective impacts and how we can think about evaluating them and those kinds of things. My partners in crime today in helping pull this together, my name is Walt Whitmer. I'm from Penn State. Scott Chazdon from University of Minnesota, who you'll hear from in just a few minutes. We'll talk about a number of these pieces. And Deborah Tootle from Iowa State University and Allison Nichols from West Virginia University Extension also helped us organize and pull together today's efforts. Find my, there we go. The CRD Indicators Working Group is a national effort of folks that have come together starting in about 2012 to try to see what we could do to sort of advance the understanding of the impact of community and economic development programs, how we might be able to aggregate those impacts, how might we better be able to understand how we approach them, those kinds of things. You can see the folks on this map around the country who are involved in this effort, and I encourage you to reach out to any of them if you'd like to join our efforts, if you have suggestions about how we can better ratchet up our collective ability to capture the impacts of economic and community development efforts. Please join us. Please reach out to these folks. And I won't spend much time here, but as I've already said, our objectives really are to ratchet up our ability and the results of sort of how can we better tell the story of community and economic development in as rigorous a way as possible, meeting all the objectives that all our stakeholders and funders have in mind. So, as we said, and you all know, we're going to talk about collective impact today. And this is a huge, huge topic. We can barely do justice to this in an hour. The best we can do is sort of to skim the surfaces, to give you a broad picture of what collective impact is and how it's being used. And then, but then we want to focus primarily on what are the evaluation issues, and what are some of the solutions, and what are some of the approaches, and how can we do some of these things better. There are week-long symposiums on collective impact. This is a fairly large and growing kind of programmatic effort across the country. And like I said, we can't do justice to it here, but hope that this does give you a sense of what this all means, and importantly, how we can go about measuring those kinds of things in real and important ways. We'll talk about all of these kinds of things. Collective impact's really an emerging model happening across the country. Last 6 or 8 years have seen an awful lot of growth in this area, and it's really, in some ways, for those of us who work in community development, might seem a bit pedestrian, because it's really about all the work. How can we focus all the work that we normally do within community development and focus it on some understandable and agreed upon indicators? And how do we create those indicators? How can we measure those indicators and those kinds of things? And how can we better speak to our collective ability to address various social issues, be it poverty or economic development or natural resources kinds of things? So that's the gist of it, really. You know, and United Ways nationally have embraced this, as well as have a number of other groups around the country. And while it takes effort, and you'll get a better sense of that in a second, many organizations are finding it worthwhile. This originally comes out of the work that some of the foundations around the country were some of the issues they were struggling with. And you know, this still occurs where foundations will put out RFPs, or you'll work with a foundation to posit an idea or a promising solution to a challenge, and then funding individual, and the effort is focused on funding individual efforts. But there was this growing recognition that funding individual efforts was not really helping us move the needle very much. So they started thinking about, well, how do we aggregate and build coalitions around addressing these issues? And then how do we identify metrics by which we can not only focus our efforts, but identify our impacts? And that's really the gist of all of this, moving sort of from a different model of isolated impact to collective impact, and being able to identify the pillars of that collective impact. Much of this work, as I said, started with the foundations, but Social Stanford Innovation Center and Tamarack Institute have been, in many ways, the prominent voices within this space in the last 6 or 8 years or so. And the work that's been done around these things really started to identify sort of 5 key pillars that, or conditions within which collective impact works. First of all, being sure that you've identified a shared vision or a common agenda. And you can imagine all sorts of coalitions around an economic development issue or a health and human service issue. There are a lot of players in this picture. So getting to some sort of common sense of where we want to be and what it takes to get there. And then stepping down to shared measurement. All right, if we have a shared sense of our vision, then what are the metrics that we can attach to that vision? And how do we get there? And then sort of mutually reinforcing activities. This sort of refers to many different organizations within a coalition contribute different things to addressing an issue. Well, how can we think purposely through how those different activities sort of mutually support one another? And as you all know, who have done, and all of you have, community and economic development work, this is complex stuff. And it's sort of made a little bit more complex by raising the issues or going through the hard work of identifying metrics. So, and the only way that this works effectively is if there's really an environment of sort of purposeful and continuous communication in a sort of open and trustful environment, and those kind of things that in general make community development work effective, but are really important to making collective impact effective. And then finally, the importance of a backbone institution to sort of be the coordinating entity that keeps all these moving pieces together and is really responsible for leading the charge, essentially. And this next example is, or this example is an example from work that I've done in the last 5 years, just to give you a quick sort of snapshot about how this may play out. We started out with 2 rural small communities sort of struggling around how to better meet the human service needs within these 2 communities. We started within a sort of a robust needs assessment that did surveys and focus groups with not only clients but organizations and businesses and industries and service providers and all those folks. And out of that came sort of a strategic plan. Well, out of that strategic plan came sort of this need, and United Way was a big partner in this at the time, was, you know, the importance of embracing a collective impact model to address the very things that we're doing. So we developed a backbone organization that I'll speak to in the next slide. But the truth of the matter is results are mixed. And From the experience and the research that's been done around collective impact, in many cases, this isn't a panacea. This isn't a silver bullet. These are just, collective impact is just perhaps a different way of thinking and aggregating activity and attention around addressing these issues. So we started a new backbone organization out of all those needs assessment efforts. It's Partners Advancing Tomorrow's Health. And we're about 3 years in now. We have 21 ongoing members who meet now monthly, although subgroups meet on a bi-weekly basis. We've had a number of achievements along the way. We've been able to get a lot more grants than individually any of these groups were able to prior, in large part because we could evidence that we were working together and we had a common plan and all of those kind of things. And we had metrics that we were all looking at, and those were attractive attributes for funders. We've also done a lot of pre and post kind of evaluations, for developmental and formative evaluations, and we've been able to identify increased collaboration, increased trust and coordination and communication and participation with clients and the public and those kinds of things. So we've been able to evidence an awful lot of change, but many of the issues that we had identified, those needles, to be honest, have not changed a lot. We were looking at unemployment rates. Those have changed some, but we were looking at diabetes rates. We were looking at decreasing teenage pregnancy, those kinds of things. Those needles have moved either not at all or very little, because there's all sorts of attribution and exogenous factors and all those things that confound all economic and community development kinds of things. We've got a long way. We have a long way to go is essentially what I'm trying to say. But it has been a very, very useful framework for us to work from. Some of the lessons that we learned, and these are mirrored in much of the evaluation and the research that's been conducted around collective impact, is building capacity within the team, within that coalition, is incredibly important. If everyone doesn't understand what everybody else is doing, if everyone hasn't come to some consensus and has the skill set to understand evaluation and what it takes to get to the evaluation indicators and metrics on which all this rests, if that internal capacity does not exist, the efforts will falter. Individual and collective goal setting is really important. All organizations have their individual goals. There's sort of agency or organization specific kinds of things. Well, how do you dovetail those with this sort of collective goals that the coalition has established? That takes time and that takes work. And there's sort of no way out but through of wrestling with those kinds of things. Starting small and simple really matters. You can't eat the whole elephant with one big bite. You know, we sort of have to start with the sort of the low-hanging fruit, celebrate those options, so celebrate those achievements and those outcomes, and then sort of build from there. Use this as a building and learning contextualized environment. And as I alluded to before, development and formative evaluations are really, really important. Scott will speak more to the attribution kind of issues. Attribution is a challenge within all community and economic development kinds of issues, particularly when we're looking at broad societal challenges. There are opportunities, but there are still challenges within all of that. So being able to embrace those challenges and being able to sort of work forward from a learning perspective is pretty important. So from Tamarack, the institute I spoke about earlier, come many of the recommendations about evaluating collective impact that are fairly important. And these are sort of broad stroke kinds of recommendations or rules, if you will. And I don't want to spend too much time We could, like I said, we could talk about all of these in far greater detail than we have time today. But all of their rules, are reflective of many of the things in the research, and are certainly reflective in the work that I and others have done around these sort of things. And it sort of starts with embracing a strategic learning approach to evaluation. Making evaluation of these efforts inform strategies rather than just reporting, essentially. How can we use the metrics that we're looking at and we're identifying to inform what we're doing, not only the outcome, but how we're doing them along the way. And that's a real important element of all of this, including that sort of developmental and formative stuff of getting real-time feedback so that we can sort of approach this from an adaptive management perspective. And recognizing that roughly right is good enough. We can't prescribe. We can't design any one of these efforts that will be perfect from the get-go. We can start small. We can start with initial steps, baby steps into these processes, recognizing that we will learn as we go, and to not be paralyzed along the way by needing to have it perfect before we start. That's really the essence of this. The other issue is being clear about the unit of analysis, or what we're evaluating. We can evaluate operations or activities or outcomes or results, or what change has occurred somewhere along the line in the continuum between the beginning of the challenge to the expected conditions we would like at the other end of the pipeline. And that's a hard thing to work through. It's hard, it takes work, it's not impossible, but we have to be on, because some organizations will want to evaluate, for instance, participation. Others will be more interested in program delivery. Others will want to be more interested in participation. Just being clear about what it is we're trying to measure, what's most important, and what are the priorities within that coalition. And as you can imagine, and as you know, in all coalition work, those are as my Australian friends would say, the hard yards, the last few hard yards of any effort. So it takes work, but it takes attention to paying attention to what we're actually aiming for. Employing multiple methods and users. It's really paying attention to the fact that there's lots of ways of evaluating, multiple methods kind of things, and multiple design opportunities, and multiple audiences, and the appropriateness of various evaluation strategies with each of those audiences. How do we take those kind of perspectives and variable needs and boil them down to what works for the greatest number of coalition members, as well as what informs how we're addressing the issue, and ultimately what our intended outcomes are. Sort of proceed with shared measurement, but do so carefully. You could imagine that if you focus purely on sort of diabetes, for instance, you could focus on what medical providers are doing, and nutrition and recreation, and you could focus, if we're not careful, too much, and we're not looking at the system broadly. So it's this sort of magic, or art more than magic, of making sure that while we are focusing, we have to, by necessity, focus on specific indicators, we can't lose sight of all of the intervening variables and exogenous factors that affect a particular outcome. And so thinking systematically and thinking broadly is really the gist of this recommendation. thinking about both anticipated and unanticipated effects of our work. Pre and post work really well in most circumstances. It gives us an opportunity to identify in a sort of rigorous sense what has been the change, whether it's change in behavior or where along the sort of theory of change continuum have our impacts been the greatest or suffered the most, those kinds of things. But looking primarily at, both where are the goals and what has been the change along the way. That's really the essence of this rule. And finally, seeking to get a rough sense of contribution rather than sort of overly being overly concerned with attribution. Any organization comes at this, well, we can contribute this to this effort. But then the question becomes, how does my contribution to this effort, how is it attributable to the actual change or the moving of the needle or those kinds of things? Those are complex discussions that are, researchers wrestle with all this stuff. Evaluation specialists wrestle with all this stuff, and Scott will speak to this more in a moment. And coalitions of folks that are doing stuff on the ground aren't generally, don't muck around in this kind of attribution, contribution kind of world very often. So understanding those and understanding how they apply to the programs and the goals that we've established is really the key. With that, I'm going to turn it over to Scott, and Scott's going to talk about a little bit more about the critiques of the collective impact model, and then move into ripple effects mapping and its potential for addressing some of the opportunities we have within this context. So Scott?
Great. Thanks, Walt. I'm Scott Chazdon, University of Minnesota. I'm an evaluation specialist. And this has been an interesting process for me I've been a big fan of the collective impact framework since, I don't know when I first learned about it, but it was several years ago, and I just loved it. And then, more recently, we've started to see some very powerful criticism of this framework. And it comes from the same perspective that would basically separate out thinking about equality versus equity. It's this idea that the collective impact model is pretty much a white model, I guess you could say. It assumes that there's sort of an equality among the players, that everyone's starting at the same starting point, and that collaboration is essentially a non-problematic, that everyone gets along perfectly well and there are no power differences among the players. The idea of a more, an equity approach is that you focus on equity of outcome, and you do everything possible to even change where that starting line is so that everyone has a reasonably good chance of getting to that outcome. So this all applies to collaboratives where you have organizations with differing levels of power. And especially when you talk about a backbone organization, it makes you ask questions about who that backbone organization is and how they are using their power in this collaborative. So these bullet points indicate the critiques here of collective impact, and I highly encourage you to take a look at the article referenced here. There are several good critique articles. This one was in the nonprofit Quarterly, Collaborating for Equity and Justice. And so much of what I'm talking about today comes from that article. But there's a lack of racial justice core in the collective impact approach, omits creative and diverse contributions from stakeholders as equal partners. They find a real big concern with shared metrics, that they're often imposed in a very kind of vertical way on participants in collective efforts, rather than sort of bubbled up or generated up from the participants. And one of the critiques is that this whole collective impact model seems to have ignored all the previous research on collaboration that is in the literature, and a lot from the participatory action research tradition as well. So the articles of the authors of this article really take the collective impact work to task. A quote from the article is that the collective impact model fails to address inequities and injustices and may in fact by its very nature serve to perpetuate them. For example, the model endorses multi-sectoral collaborations consisting of organizations that often are complicit in maintaining prevailing power dynamics that perpetuate racial and other forms of inequity and injustice. So, Walt, if you could advance to the next slide. In this article, Wolf and his co-authors identify 6 principles for collaborative practice. And I'm just briefly going to mention these, and then I'm going to counterpose these with the 5 pillars of collective impact in a moment. But the 6 principles are: 1, they explicitly address issues of social and economic injustice. 2, collaborative practice must employ a community development approach, which is interesting to speak to this audience. We all like to think about those CDS principles, and a community development approach where you're really engaging your groups and your participants in being part of the solution. Employing community organizing as an intentional strategy. So building upon this idea of not doing for communities, but doing with communities. Focus on policy, systems, and structural changes. Building on community engaged scholarship and evaluation methods. And another principle is you're constructing core functions for this convening group based on equity and justice. So there's still, I think they're saying there still could be a backbone organization, but that backbone organization is democratically governed and is organized around themes of equity and justice. So as I reflected on the critique and my true love of the original collective impact framework, I started thinking to myself, are they really in conflict? Or is this basically an enhancement, or us perhaps thinking more critically about this equity lens that I think increasingly we're asked to think about in our work in extension and beyond? Are the folks we're working with all starting at the same starting point? And that needs to be really thought about. History needs to be thought about. And some of our actions need to take that into account, that different organizations will come at the work from different places. And you have to correct some of those imbalances of power. So my point in putting this slide up is that I don't necessarily see these as in conflict. Perhaps these 5 on the left, the collective impact 5 pillars, are more kind of structural elements that have to be there. And the stuff on the right from the critique is really more about the soul, as far as I can tell. It's the soul of the work that you can't forget about as you're focusing on the structure. So the next slide, I think many of the differences between these 2 models can be resolved. And I do also think that some of the critique, it reminds me of some academic arguments where one party creates a straw man or a straw person out of the other. There seems to be some of that going on in the literature, instead of what I would rather see, which is just how can we use this collective impact model with an equity lens, essentially. One issue that is a consistent concern is the imposition of shared metrics. When I learned about the collective impact framework, it really was at the time coming from philanthropy. That foundations were really pushing this approach because they could get all their grantees that were working on the same issue to report the same indicators. And it did feel like ambitious, but at the same time very top down. very, pressured. And I actually worked with some grantees in a situation where they were expected to report shared metrics, and they didn't have the resources to collect the data. It wasn't necessarily the data they would have chosen to collect. So there are a lot of issues here. So I'm going to talk a little bit more about ripple effects mapping today, not because I think it's the best thing in the world and the only solution here, but because I think it is a way that, and it came from extension, but it is a way to address some of the concerns that have come forward around shared measurement. And it's also very much from a community development way of thinking. So Walt earlier talked about also the need to show both intended and unintended results. And that's, to me, part of the whole definition of ripple effects mapping. It allows you to surface both intended results from programs or collaboratives, as well as the unintended things that bubble up that you don't necessarily expect to see. So, next slide. So, as I mentioned, ripple effects mapping is a way to address some of those simple rules that Walt talked about earlier that came from Tamarack. And it's interesting because Tamarack doesn't necessarily know about ripple effects mapping. We'll have to work on that. They know about outcome harvesting, and they know about most significant change. Both of those approaches are neat. We talk about both of those in our book on ripple effects mapping and criticize each of them a little differently. So just to let you know that those are other cool approaches that you could employ. But ripple effects mapping does allow collaboratives to visually demonstrate collective impacts. And because it's a group process, it also allows participants to actually further make connections while they're evaluating the work and further the collaborative nature of the work. It gets at the so what from collaborative efforts. But, and Walt was talking about this idea of attribution. We like to talk about this but-for attribution principle in extension. If you ask someone, would this thing have happened if not for, it could be your organization's involvement, or it could just be if not for the whole collective effort. But you can have that but-for question as part of a ripple effects mapping process. And that ends up being quite interesting. Next slide. So the purpose of ripple effects mapping is, in fact, to better understand intended and unintended results of a program, intervention, or collaborative. And I'm going to talk in a later slide about all the examples of collaboratives where there's been published work now on the ripple effects mapping process. You can conduct it either in a developmental evaluation way, kind of mid-process in a program, and then again in a more summative process. So you can have it done more than once. You can just do it as a summative process, maybe a year or so after a collaborative effort. And it's never intended to be the only evaluation tool used for a program. So when we talk about it as a good tool for evaluating collective impact, it's not supposed to be the only tool. There probably still should be some discussion of other indicators that the different partner organizations could be collecting. I often like to talk about the fact that collaboratives and high engagement programs, and in fact extension, historically extension programs in general, build social capital, but haven't done a great job taking credit for it. In fact, I sometimes like to talk about the traditional county agent's role is one that builds social capital, but we don't have a great track record of documenting how that social capital got built by that county agent. And throughout the history of extension, I think there has been a huge amount of relationships and trust built by that person in that position. But this is also true of collaboratives and highly engaged programs, that we want because people don't act in isolation, to measure how those connections are made, and then the so what from those connections that are made. Relationships tend to lead to new things happening. And a very smart consultant I know says, change flows along the lines of relationship. And so if you can document that chain of effects and how those relationships work, it's very, very powerful. And again, the ripple mapping gets you information about things you might have a really good theory of how your collaborative is supposed to work and lead to the end results. But there could be other things happening that you didn't envision, often positive, sometimes negative, and the ripple mapping can surface those. Next slide. So I'm excited, if you haven't seen it, to say that now we have a wonderful free online book about ripple mapping. And there's the link. You can also just Google a field guide to ripple effects mapping. The book has lots of case studies, 13 case studies. I'm going to mention some of them in a minute. And several of those case studies are collective impact situations. They're collaboratives. But the book also has sort of a lit review chapter where we talk about these core ingredients of ripple mapping. Appreciative inquiry is a very important one. You know, appreciative inquiry, I love the definition. The cooperative search for the best in people, their organizations, and the world around them. You start the ripple mapping process with appreciative inquiry questions, and those tend to surface a lot of really interesting insight. People interview each other in pairs, and it surfaces a lot of insight and stories that end up then later being put into a mind map in which you are able to document visually the chains of effects from a program. There's a very participatory approach to this process. You're engaging stakeholders, not only people close into a program, but there's an opportunity to engage other community stakeholders who may not be directly involved, but who may know about some of those effects from a more distant perspective. And they can help you make connections in these chains of effects by saying, oh, that happened? And they can help you connect it to that far away thing happened because of something you did in your program. There's a process of interactive group interviewing and a process of group reflection in the ripple mapping session. And as I mentioned, we use a mind mapping process, either live during the session or after the session. You can take what was written on butcher paper and put it into a mind map afterwards. We have a few different approaches to this that are documented in the book. 3 approaches so far that are very clearly documented in the book. Next slide. I just want to mention, and I know that some of the collaborators on the book are actually on the webinar. These here on the screen are some well-known collaborative extension projects that have used ripple effects mapping as part of their evaluation. We also, in the book, have an example of, in Wisconsin, the Pierce-St. Croix County efforts, Child Welfare Coalition that used ripple mapping, youth-adult partnerships to reduce poverty in Lamar, Missouri, a hunger coalition in Northeast Washington State, an arts collaborative in Chewelah, Washington State, and community healthcare coalitions in Minnesota. So that's 10 really good examples and many of these on the screen are also in the book. The Horizons, Marketing Hometown America, and Turning the Tide on Poverty all have case examples in the ripple mapping book. So you can go to that as a resource and see how it was done and think about how you might use it in your collaborative situation. Next slide. So actually now we have some really good time, about 15 minutes for Q&A using the chat pod. And I just do want to point out a couple of important housekeeping things before we go to that. Our next webinar is called Evaluating Community Development Impacts Using Qualitative Indicators. And Rebecca Ciro, I think, is on this call, and she is going to be one of the co-leaders along with Paul LaChapelle from Montana. Rebecca's from Washington. That'll be April 23rd at 1 o'clock Central. All the past webinars we've done are also at that RRDC website. And there is an important evaluation survey we would like you to fill out from today's webinar at this link on the screen. With that though, and I think we can keep this up so you can have the link. Let's move to questions and answers using the chat pod.
Catherine, I've been tracking some of these, but I've been more listening than I have been paying attention. Whitney's, well, I guess, whoop, I'm a little bit further, but Whitney asks sort of, I'm curious about the role other extension educators have played in collective impact, and are extension offices backbone organizations or leading workshops and groups around this kind of things? What's your sense, Scott?
Well, I think sometimes extension does serve as a backbone organization. But I guess I can think of examples of both where we're just part of a collaborative as well. So it's an interesting question to whether, I know that there's a lot of work going on around food systems, for example, in Minnesota, where extension is really acting as a backbone organization for a lot of collaborative efforts.
And Mary noted that she's aware of extensions organizations in lots of parts of the countries and in Missouri serving as that backbone organization, both leading it and evaluating it, but usually, you know, it's context driven, it's context specific.
And what really comes up then, if extension is acting as a backbone organization, is given that critique,
right?
You know, thinking about that equity lens, and so there's an extra heavy burden if you're acting as a backbone organization to make sure that you are truly collaborating and engaging all the different partners in something that is truly a collaborative and not something that's driven by the folks with the most resources. And it's a hard thing to do.
Mm-hmm. And Scott, this is another one for you. Does REM help get to final outcomes, or is it generally more focused on process and developmental kind of things?
Actually, it really does surface a lot, and there's others on this call who can comment as well, but you get a lot of very, very specific outcomes from the discussion. And one thing that you can do, and to make it perhaps more systematic, is, for me, the REM often identifies core themes or core pathways to outcomes, and you get some specific outcomes reported. But if you want to go back and do a survey with a perhaps more scientific sample or a larger sample of stakeholders, you could do that, but you would have a much better idea what kinds of questions to ask as a result of doing the ripple mapping. And you could get documented numeric measures, like how many, you could get counts of things that you might want counts of, or dollar values of things you might want dollar values of, if you go back and do a survey.
Well, and someone else had wondered about examples of collective impact style collaborations with extension and state departments of public health. Perhaps some of you on the call have examples. The one I referred to obviously was an extension effort, and the State Department of Public Health, as well as the local Office of Health and Human Service Delivery, were sort of the initial catalysts in this effort, as well as the United Way. So it poses a challenge in some ways it posed a challenge to me. I'll speak to my own personal experience. Because this is so labor intensive, it sort of requires that extension systems are willing to embrace the sort of murkiness or the ambiguity of working through these long, hard processes. And not all extension folks or systems are willing to have that on their sort of programmatic radar. From my perspective, there may be other examples that you all have, but you know, this is, from my perspective, this was a 5-year effort that took an awful lot of attention in 2 counties. So there's the limited resource aspects to all of this, but I would argue it's entirely within our wheelhouse. We do community development. This is consistent with community development principles and goals and intentions. And so, but to a less extent, it marries the sort of the strategic planning and the identification of metrics and those kinds of things. So it is a kind of there's a lot of moving pieces here, but I would be interested actually, and if those of you on the call could either post in the chat or be in touch with us in other environments. We did a similar workshop to this at NACDEP, and there was a fairly rich body of experience in that discussion, and also a fair bit of interest in us organized, which we have not yet done, in spending a day or two to delve into all of this more deeply and what it means for extension and how extension can address sort of the intentions of collective impact in a way that's adaptive to many of the critiques and in keeping with the principles of community and economic development.
I just think there was this question about working with the State Department of Public Health, and I know that and that's a different part of extension from the one I work in, but I know that our food systems people and our nutrition people have done a lot of work with the State Department of Health. And what's interesting to me there is how challenging it is for a large state institution, a state organization to do collaboration, really. I mean, it's because they have such a top-down approach typically to doing things. And so it's interesting where extension works with them. Extension often is less top-down, you know, when it's working well. And I've seen a fair amount of conflict go on where extension tries to work in a more grounded way than what perhaps a state agency is comfortable with. And then I think extension sometimes gets critiqued for not working in a very bottom-up way. So it's always challenging.
It is, for sure. Dan raises that issue too, that system administrators in extension sometimes demand faster returns, faster results. And this is the hard work of community development. And we all appreciate that, but that appreciation is not always as widespread as we might like otherwise. And Whitney had offered some interest, and they've done some work in Marion County, and that they would be interested in sort of coming together and brainstorming and working through how we might better be able to address these issues within the context of extension, which I would welcome wholeheartedly. I think there's a fair bit of interest as this all emerges, and I and others think that more sort of robust and in-depth discussion about what this means and how we might be able to share resources and do these things more effectively, I think is both warranted and could be really, really useful for our work.
Oh, I just saw this really good question about how do you put racial equity at the core in an environment that's mostly white? So obviously it's not only racial equity that one would need to think about, especially if it's not a racially diverse area. Certainly you could think about poverty issues and who has resources. Could be thinking about gender issues potentially. So there's other differences in power that one would need to attend to. So I think that the whole idea is thinking about that goal of everyone reaching the apples on the tree, and is everyone starting from the same place on the ground or not, and just thinking about that. You know, that graphic is interesting too. I don't know, for those of you who have seen various versions of that image about the difference between equality and equity, but the first image of that I ever saw was 3 white boys looking at a baseball game. And so it's just interesting to me to see, you can look at Google Images to see even how that image has changed in recent years. And now it's, this one is interesting with just the figures where you're not even identifying race or gender. I think that's, but it could be any of these different inequalities that need to be attended to.
And Dan offered that, in the context of extension, if process is product, and process being convening partners and establishing collective plans, etc., adopting plans, engaging public, then extension can have wins in both ways as we work towards that broader outcome or product goal as well. So again, I think it's largely, and there's long-term impacts, there are immediate-term impacts, there are attribution issues, all of these kinds of things that are critically important for us to have as best a handle on as we can get. And being able to communicate the importance of these kinds of things along the way. Another question is, can you tell us what it means, in your view, to put racial, oh, you got that one, and how can I get involved and partners with you all who are working on this? Put your name in the chat is the best place to start, or connect with anyone on the CRD indicators group that I listed before. But put your name in the chat, because there is this sort of bubbling discussion, like I said, coming after NACDEP last year, of, boy, we really need to delve into this more. And how can we raise our collective capacity within an extension to think more comprehensively about what this means, and how can we help communities do this kind of thing. There was all those sort of levels of interest, but the truth of it is, this has been a year that flew by, and we haven't yet been able to pull that together. And so if you have ideas of how that might be most effective for the most people, or how we might be able to engage in those discussions, that would be really useful. Really, really useful. And REM facilitators need to be sensitive to different cultural values when recording and cataloging impacts. This awareness is key to Native American communities. I think that speaks, at least in part, to what you were raising, Scott.
Yeah, and it's really helpful with ripple mapping to have a co-facilitator, especially if you're working in a situation where the person who would normally be facilitating might not be of the same cultural background as most of the group. So I think you want to think that through a little bit and have a co-facilitator who is from that community. And so that's been an important part of some ripple mappings we've done here. And yeah, I also did some with some tribes in northern Minnesota where I had the local program person really co-facilitate the session with me, and that was very important.
And Allison says in their work and extension, they've also seen the need for shared measurements and real-time data, etc. And they developed a website management system to assist them in doing that. Allison, I would love to see that. Maybe this is something, she says, that would help others in measuring collective impact. I would love to explore that more with you. That's anything we can do and draw from the experiences and lessons that others have learned in this process contributes to our collective ability to think through these kind of things and put them together in a way that is useful for all of us. So yes, please share. And we had another question. Can we speak to why there's no one in our group from California or the Southwest?
Mary addressed that one.
She did. Okay.
Yeah. There's no reason we couldn't have someone from California or the Southwest. We would love that.
That's exactly right. That's exactly right. Any collective impact type work with livability or age-friendly? I don't know of any per se, but others on the call may. And again, if you have, it's a great question. If anybody on the call has experiences or even has thoughts about how that might play out in those contexts, we'd love to hear them. Mary says maybe we could be sure that the main facilitator is of the culture, sort of what you spoke to, Scott. We'd love to share, this is from Allison again, we'd love to share if you'd like to see a demonstration of this system. And she gives her email. Be careful what you ask for, Allison.
We do have these quarterly webinars, so yes, be careful. We could get asked to do one of our quarterly webinars.
That's exactly right. No, thank you for that. We greatly appreciate it. You know, you all have lots of experiences in this, so and the more we can pull these together and the more we can share those experiences and lessons learned, the better. Can we post links in the chat? Yep. And we need to follow up with it. Yep. And another note from Mary. And we are at 2:59.
Yes,
so,
and those links that Aaron asked about, they are in the chat box. You might just have to scroll up to the top.
Yep. Yep. And we won't close the link here right away, so that you have an opportunity to both check those links, and still on the slide is the link for the evaluation from today's webinar. We really hope you can to complete that evaluation. That really helps us in thinking about what you all are most interested in terms of evaluation and CRD programming, context, and those kinds of things. And it's from your suggestions that we set out our plan for continuing an ongoing webinar. So please, it helps us. Scott, anything else, or Catherine, for the good of the order?
Maybe we could paste the link again, because I'm not seeing the link to the evaluation. Can we paste it again? So that
yes, I will go back and do that right now.
Thanks.
Great. Thank you, Catherine.
I can find it.
So otherwise, thank you all for joining us today. And send us your suggestions, your links. And will be convening a discussion around how we can move this forward, this whole collective impact and evaluation context. So I will be convening a discussion. What that looks like quite yet, I'm not sure, but I will tag some of you who have shown interest and others who we've talked to in order to sort of take the next couple of steps in sort of more proactively addressing these kind of things. So with that, thank you all and enjoy the rest of your week, although there's not too much left in it.
Yes,
Bye-bye.
thank you all very much. Thank you, Walt and Scott, for a great webinar. And we hope to have everyone join us again in April. I'll leave this open for a few minutes for everyone to copy and paste the links, and then we'll go ahead and close out. Thank you guys again.
Great. Thank you all.
Thanks.